Here are 5 common tennis injuries outside of elbow pain. So number 1, we want to split up our tennis-related injuries into those that are more of a chronic nature versus those that are more acute. When we're getting those that are more chronic in nature, we're talking injuries typically to the upper limb. And one of the more common injuries here outside of elbow pain is shoulder pain. So this might be in the form of rotator cuff tendinopathies, and this can be quite prevalent in those from serving, and typically these are quite painful. However, a lot of people try and push through them and then they just continue to get worse. So definitely seeing someone early is really important in the management of these injuries here. You might also have a slap lesion in the shoulder there that is contributing to that shoulder issue too. So these are more chronic in nature versus those that are more acute. They will occur a lot in the lower limb and trunk. So trunk injuries in tennis players are very common. Abdominal strains being very prevalent. You might even get low back pain, but abdominal strains are very prevalent in tennis players, and it makes sense. They're generating lots of rotational force in their hits. So abdominal strains can really be painful and be detrimental to a tennis player when they hit them. So we get quite a few injuries where people have to retire hurt in tournaments due to an abdominal strain. When we go lower down, we're looking more into the hip, and we've got groin-related strains. So this happens quite frequently with the lateral change of direction that tennis players have to do multiple times at high speeds. When we keep going down, we're looking at knee injuries, the acute nature, one being a meniscus tear. These are quite prevalent as well, and we've seen quite a few tennis players recently going for surgery on these to try and get back and play. And then when we go further down the list there to the ankle sprains, which sometimes will result in fractures. So ankle sprains are very common in tennis players. Again, a lot of it is due to large forces going through the ankle and change of direction. What we can do about these injuries is pretty simple. It's strength and conditioning. Load management with a good strength and conditioning coach, osteopath or physiotherapist goes a long way into managing these injuries and mitigating the risk. So I highly encourage everyone to go speak to your health professional, especially if they've got a vested interest and passion in strength and conditioning. If they don't, go and find a good strength and conditioning coach that understands the way you move and understands the loads that are going through your body when you play tennis.